My area of research is focused on optimizing medications for patients, particularly looking at the optimal dose to maximize efficacy and safety considerations. And I've always been interested in math and quantitative sciences, so my research focuses on mathematical models that can be used to predict drug concentrations in blood as well as tissues in the body. Many of the patients that we see have liver impairment or kidney impairment, and those two organs are the main organs that eliminate drugs from the body. So we build mathematical models to predict those changes and then calculate appropriate doses for patients that have those diseases. I've been taking care of patients with CF or cystic fibrosis for about 30 years. So cystic fibrosis is a genetic disorder, and it leads to chronic lung infections in these individuals. In the last 5 years, there's been a new therapy that's come out called Trikafta, and this has significantly advanced the care of patients. Their lung function significantly improved. Hospitalizations were reduced by about 2/3. So that's greatly enhanced their life expectancy and their quality of life. So a lot of my research has been focused on trying to predict those drug interactions, because obviously with the benefit from this drug, you don't want to have to take the patient off because of interaction with another drug or a disease interaction like liver disease. One notable one was Paxlovid, which is a medication for COVID that came out the same time as Trikafta came out. And there wasn't initially any guidelines for dosing on it. It turns out that Paxlovid has one drug component called ritonavir, and this significantly reduces the breakdown of the Trikafta components in the liver. So the levels can increase significantly. So normally we dose Trikafta twice a day. With this medication, turns out we dose it twice a week. So it's a substantial interaction. I think that the clinic work is very important because that's where I identify my research questions. My work is looking specifically at the medications. So these patients are on 15 to 20 medications to manage the lung disease as well as some of the gastrointestinal effects of the disease. So we're evaluating all those treatments, making sure that they're responding appropriately, there's no adverse reaction or drug interactions. And the other big thing is some of these medications are quite costly these days. And so we have to work on how to get access to these medications and make sure that they have insurance, co-insurance, and some kind of coverage to make sure they can maintain these medications.